Hi, this is Brandon Todd of Medigap360.com. Welcome to my presentation of Medicare A Complete Overview. Medigap360.com is not affiliated or endorsed by the federal Medicare program or the government. This presentation is only for informational purposes and intended to help people on Medicare understand their coverage. So with that out of the way, let's get started. First of all, what is Medicare? Medicare is a government health insurance program for people age 65 and older, people under age 65 with certain disabilities, and people of all ages with end-stage renal disease, which means they have a permanent kidney failure requiring dialysis or a kidney transplant. So if you meet any of these criteria, you're eligible for Medicare. Now on Medicare, you have basically two options. You have Original Medicare, which is known as the Medicare Fee-for-Service Plan or Medicare Parts A and B. And you have Medicare Advantage plans, which are private health insurance plans sponsored by private insurance companies that replace Medicare Parts A and B. And let's talk a little bit about Medicare Advantage plans. First of all, you have to be eligible, you have to live in an area where there is coverage. The insurance companies call this a coverage area, but the private plans can choose where and when they want to provide coverage, and you have to live in an area where one or more Medicare Advantage plans offers coverage. If not, you are not eligible for Medicare Advantage. It limits coverage to restrictive networks or private fee-for-service plans where your provider must opt in to choose the plan. It's an annually renewable contract, so from year to year, the private insurance company can choose to renew or non-renew their contract. If they choose not to renew, you will be left without coverage. You will have to go back to Medicare Parts A and B or find a different Medicare Advantage plan. The coverage differs between companies. Some private insurance programs, they can make up their own guidelines and their own policies and procedures for administering your health insurance. It's not like Medicare Part A and B, which is a pretty much one-size-fits-all comprehensive coverage. And one other thing to note is that plans will provide you a handbook upon your enrollment that outlines the complaints and appeals processes for denial of services. So if you are denied services, there is an appeals process. Please note that when you are denied services, it's normally when you're sick, and having to go through an appeals process can be a real hassle, and it can also be time consuming and keep you from getting the care that you need. But Medicare Advantage plans are required by law to give you a handbook that outlines their appeals and denial of services processes. And if you're on a Medicare Advantage plan, you will no longer be eligible for Medicare supplement insurance. Of course, Medicare Advantage plans normally have deductibles and coinsurance, just like Medicare Parts A and B, but there is no Medicare supplement policy that covers Medicare Advantage plans. In fact, if you're on a Medicare Advantage plan, you're no longer eligible to get Medicare supplement insurance. Now, the original Medicare plan is a little different. As you know, it's also called Medicare Fee-for-Service or Medicare Parts A and B. It has no doctor restrictions, no hospital restrictions. You can go to any provider that accepts Medicare, which we know is just about every hospital and doctor in the country. There are only a few scattered here and there that do not take Medicare, and that's for very strange reasons. And if you're on the original Medicare, you are eligible for Medicare supplement insurance, which is a good thing because you can get Medicare supplement insurance, comprehensive Medicare supplement insurance, that along with Medicare can potentially pay 100% of all your doctor and hospital bills, and you will never have to pay a penny besides your monthly premium. Which, if you're a senior and on a fixed income, budgeting in your healthcare expenses like that is a tremendous value. Now let's talk a little bit about Medicare supplement insurance, or Medigap insurance is the official term, but it's most commonly known as Medicare supplement. Medicare supplement plans are plans designed to pay for the coverage gaps left by the original Medicare fee-for-service plan. So if you're on Medicare Parts A and B, there are going to be gaps in your coverage, and Medicare supplement coverage is designed to fit into those gaps like a key is into a lock. There are no doctor restrictions with Medicare supplement, no hospital restrictions. You can go to any provider that accepts Medicare, just like Medicare Part A and B. Now let's talk about the original Medicare plan, also known as the Medicare Fee-for-Service plan or Medicare Parts A and B. There's basically three parts to Medicare. You have Part A, which covers anything done to you inpatient as you're confined to a hospital. Part B, which covers anything done outpatient in a doctor's office or hospital or clinic. And Part D, which is prescription drug coverage, which is a couple years old now. Medicare Part D covers your prescription drugs. Now let's first go over Medicare Part A and how it works. Medicare Part A covers inpatient hospital services, skilled nursing facility care after a hospital stay. Now, skilled nursing facility is defined as where a registered nurse must be on duty 24 hours a day, not one shift a day like intermediate nursing or custodial nursing where it's 2-year nurses. A registered nurse has to be on duty 24 hours a day for it to be a skilled nursing facility, and it'll only cover you after a hospital stay. It also covers a limited amount of home health care and a limited amount of hospice care. So let's talk about the first part, which is inpatient hospital services. This is how Medicare Part A will cover you when you go into a hospital and are confined. The first 60 days, Medicare is going to pay 100% of your expenses except for the Part A deductible, which in 2008, the number is $1,024. So the first $1,024 of charges when you get put into a hospital, you're going to have to cover. After that, Medicare is going to pay 100% of all your hospital charges for the first 60 days. After that 60 days, we get into, they call it coinsurance, but I like to call it daily deductibles. And the way they work is this: from the 61st to the 90th day, Medicare is going to pay everything except for a daily deductible of $256. And that $256 is, of course, a 2008 figure. But the way that works is this: you wake up the 61st day in the hospital, you pay the first $256. That's your daily deductible, and then Medicare pays the rest. The 62nd day, you pay the first $256, and then Medicare pays the rest. And on for 30 days until you've reached the 90th day in the hospital. So your total expenditure that you could pay of $256 times 30 days is $7,680. After 90 days, you get into what's called lifetime reserve days. And these are days that you spend after your 90th day in the hospital. And what these are is you get 60 of them in your lifetime. Once you use one of them, they're gone forever. So you wake up the 91st day in the hospital, and Medicare is going to pay everything except the daily deductible, which is now $512. So you wake up the 91st day in the hospital, you pay the first $512, Medicare pays the rest. You wake up the 92nd day, you pay the first $512, Medicare pays the rest. Now you use 2 of your 60 lifetime reserve days, so you only have 58 of them left. And so on and so forth, and that goes on for 60 days. Now the total out-of-pocket amount that you could spend if you were in the hospital for 150 days is $30,720 of the lifetime reserve days, plus $7,680 of the days 61 through 90 daily deductibles, plus $1,024 of the Part A deductible. And that's your exposure with Medicare Part A. But overall, this is very, very comprehensive and good coverage. The last thing is there's a 3-pint blood deductible. So the first 3 pints of blood are not covered under Medicare Part A. Now, skilled nursing facility is the second part of Medicare Part A. And this covers you like this. Remember, a skilled nursing facility is where a registered nurse must be on duty for 24 hours a day. Now, it only will cover you after a hospital stay. And for the first 20 days, it's going to pay 100% of all your expenses. Then from the 21st to 100th day, you're going to get into more daily deductibles, and that's in 2008 is $128 a day for those 80 days. Overall, that could be $10,240 that you would have to pay. Other Part A services, of course, include home health care in very limited instances and hospice care in very limited instances. My experience with hospice care is that they don't cover it for long-term hospice care, but normally just right at the last period, the last couple of days before you die. Now, Medicare Part B is a little simpler. What's covered is medical expenses, clinical laboratory services, and outpatient hospital treatment. Just about anything that can be done to you outpatient. So when you go to a doctor's office, you go to the emergency room, you have labs or x-rays, or you have day surgery in the hospital. As long as you're not admitted to the hospital overnight, then Medicare Part B will cover it. How Part B works is this. The first $135 in 2008 is known as your Medicare Part B deductible. And from January 1st to December 31st, the first $135 worth of charges you will be responsible for. That's your Part B deductible. After that, Medicare pays 80% of the approved amount for all charges once that deductible has been met. And then there are preventative services such as screening tests, flu shots, and vaccines. Now, Medicare Part D, prescription drug coverage of Medicare, a little bit about that. It's prescription drug coverage offered by private insurance companies that have a contract with Medicare. The companies are able to create their own plans, their own limitations and exclusions, and each plan has a different formulary. Now, don't be confused by the word formulary. It's just a big insurance company word that means a list of drugs that the plan will cover. So when choosing a Medicare Part D plan, the best thing to do is make sure that the drugs that you take or have a high probability of taking will be covered under your plan. And finally, you must join a prescription drug plan to have prescription drug coverage. It's not automatic by any means. You must seek out and find a Part D plan and enroll in that plan to have the coverage. Let's talk a little bit about Medicare Advantage plans. Medicare Advantage plans, there's four main types: health maintenance organizations, which I believe are the coming of evil in our country, and I could talk for hours about it, but I'll digress. Preferred provider organizations, which are simply plans that have a list of doctors and hospitals that you should go to. And private fee-for-service plans, which are plans that will pay any doctor or hospital, but the doctor or hospital must choose to accept the plan or you will not be covered. So what happens, and we're seeing a big trend towards this lately, of physicians who were once accepting private fee-for-service plans, but because of the administration and the headaches involved have decided not to. And they're not having to tell their patients when they quit doing it, because they often don't know their patients are on these private fee-for-service plans. So we have a lot of people who are going into their doctor that they've probably been seeing for many years and not being able to get coverage or get services without having to, one, pay out of pocket, or two, go to a different doctor that, if they can find one, that accepts the plan that they're on. And then there are medical special needs plans, which are very rare plans that you see for people with certain conditions. So let's talk about, now that you have Medicare, what services are not covered by Medicare. You have your coverage gaps, which we discussed. Non-covered procedures such as cosmetic surgery, routine foot care, anything that's not medically necessary, private duty nursing, dental or dentures, most vision treatment, routine eye care, eyeglasses, except one pair of eyeglasses after cataract surgery, and hearing aids. At-home recovery, when you're recovering from a hospital stay and you need someone to come by and do light housekeeping or nursing duties. Foreign travel, which is health care received while traveling outside the United States, except under limited circumstances. And long-term care, except for the first 100 days of skilled nursing. Skilled nursing after 100 days is not covered. Homemaker services are not covered. And custodial care, or help with activities of daily living, are not covered. Normally custodial care is done in a nursing home, an assisted living facility, or in your home. And that is the long-term care that's not covered by Medicare. I recommend everyone look into long-term care insurance to take care of those needs. And so let's get down to the bottom line of, after you have all of this great Medicare coverage, what are you going to have to pay? What is left? And remember, I'm talking about what you'll have to pay without with Medicare alone, not with if you have a Medicare supplement policy. Medicare supplement policies are designed to pay these gaps. What you pay is premiums. That's the amount you must pay regularly to keep your coverage. You're going to pay deductibles, which is the amount you pay before service insurance begins, and co-payments, which is a fixed charge for a medical service. Let's talk about premiums. What premiums will you have to pay? The Part A premium, but that's paid for life once you pay enough quarters into Social Security. I think it's about 39, so about 10 years. Once you pay 10 years of Social Security tax, you're paid up for life. And if you haven't paid that much, it's an opt-in premium for you. You can, on a sliding scale, you can choose to pay that premium if you wish. The other is the Part B premium. The Part B premium, everyone must pay it, and the premium amounts may change each year in January, but it's $96.40 here in 2008. The other thing that you pay is deductibles. Let's look at those. The first deductible that you'll have to pay is the Part A deductible, which is $1,024 in 2008. And that's charged upon your admission to the hospital. It can be charged as often as once every 60 days. Part B deductible, which is $135 in 2008, and it's charged on your first outpatient expenses in a calendar year. And then you have your blood deductible, which is the first 3 pints of blood. And the final thing that you'll have to pay is coinsurance, and these are the amounts that we talked about. You have skilled nursing coinsurance, which is $128 per day from the 21st to the 100th day. You have hospitalization coinsurance, which is days 61 through 90 in the hospital. You pay $256 per day. You have your lifetime reserve days, which are 60 of them. Many people will call this your 91st to 150th day in the hospital, and that's assuming that you do have a continuous stay. During these, you pay the daily coinsurance of $512 in 2008. Now, your needs outside of Medicare. First of all, having Medicare is a great privilege to have. It is I would say, the most comprehensive and best healthcare coverage that exists in the entire world, because you can go to any doctor, any hospital, and have just about every medically necessary procedure covered and at good coverage rates for a very low premium. But then you're going to have needs outside of Medicare. The first is to have a great exercise and wellness plan, including a healthy diet. I can't stress this enough. There's something that amazes me in our culture where people get a health insurance policy and they call it a health plan. That is not a plan to be healthy. A health insurance is in case you are not healthy. It's not a plan to keep you healthy. You need a great physician and routine checkup plan. Of course, you want to be in the best shape possible, and having a physician you can trust and seeing him regularly to diagnose and prevent disease is a great idea. You want to have a plan to pay your premiums. This is a financial consideration that you must make. The premiums you're going to have to pay, like we talked about, are the Part B premium, which is $96.40. That's normally taken directly out of your Social Security check, so you don't even miss it. And it's a real bargain for what you're getting. And the other premium you're probably going to have to pay is Medicare supplement insurance. So you want to find and use Medigap 360 to find low-cost Medicare comprehensive Medicare supplement coverage, and find the best plan for you, and then find a plan to pay for it. The great thing about Medicare supplement insurance is that if you get a comprehensive plan, it can cover 100% of all your doctor and hospital bills after Medicare is paid. So whether you have no healthcare expenses, or you have $1 million of healthcare expenses in any given month, it's going to cost you that same comfortable monthly premium that you've already established in your budget. And if you're like most seniors that I talk to who are on a fixed income, that makes a lot of sense. And then you need to, of course, make a plan to pay for your deductibles and coinsurance, which again is why I recommend Medicare supplement insurance. So, with that said, I appreciate you listening to my presentation on Medicare A Complete Overview. My name is Brandon Todd. please visit me at medigap360.com, Medigap360.com, and I'll look forward to talking to you soon.